Hi, this is Christopher from Maloney, naturopathic doctor. I'd like to talk to you about sleep. Most of us don't get enough sleep. Some of us don't get any sleep. A few of us get way too much sleep. The average person should get about 3 to 6 and 7 hours of sleep, but if you're a growing individual, you need to be getting 8 to 10 hours of sleep, and very few of those children are getting that. If you vary your sleep schedule by as much as 5 to 10%, you really greatly increase your chance of illness. If you continuously vary that sleep schedule, you really set yourself up for chronic illness of some kind. Whether that's low grade and your body can handle it, or whether it actually manifests as something that's legitimately diagnosable. These are things that, sleep is one of those things that we all need. For the most part, pharmaceuticals are not effective at treating sleep disorders. They may put you to sleep, but that drugged state is not that deep relaxation state you need. In many cases, you also avoid REM state, or the dream state of sleep, which is very necessary for kind of rewiring or resetting yourself for the next day. So I would recommend strongly looking at lifestyle and life changes to help with sleep before engaging in long-term drug use. If you look at the actual handouts for the drug use, the drugs currently in use, something like Ambien has been diagnosed and treated. If you're diagnosed and treated with a sleep disorder, it's only for short-term use, maybe up to 2 weeks. And I see patients who've been on it for years. It causes all sorts of interesting side effects, it causes interactions, and it really ultimately doesn't give people the kind of rest and sleep that they need. So for me, the sleep discussion begins with an assessment of how much you need, and then the second piece of that is to deal with all of the stresses and the things that impact that. For the most part, what I've found is that patients have the ability to sleep more. They simply get too tired to actively sleep, or they have too many distractions at the end of the day to get to a decent rest. Occasionally I'll see a true insomniac, but even in that case they tend to get micro sleeps throughout the day. It's very rare to see someone who doesn't sleep at all. And finding that and maximizing the benefits they get from what sleep they do get is really the key to helping them get well.